Okay, so a tuberosity is a rough projection or protuberance of a bone that serves as an attachment for muscle, so you do that part. Okay, causes the depression, and notches are concave. Without difficulty of time. Yeah, that picture that has to put there on.
All right, good morning, everybody. We're going to begin here. Welcome to week 9 of the fall term. Today, we're going to do initially some patient care material, and we'll move into physics, and then we have some housekeeping to do. Let's do a voice check. Type in the box if you can hear me. Very good. All right, we left off last week talking about asthma. And I think we discussed how serious this condition can be. So moving now to choking and the Heimlich maneuver. Medical emergencies. The chapter titled Medical Emergencies in your book. Choking. All right, so what's the hallmark question you ask a patient? If they're what? Can you breathe? And they're usually doing this, right? Now, or when you did your CPR training, did you have to demonstrate that at all? On a what? On a mannequin? In other words, the key here is if you have to do this, the key is where you place your hands. You've got to place your hands in the proper spot to get that thrust. Now, let me ask you this, and you can type in the box. When you did the practical piece of your CPR, did they ask you to ask the patient? I mean, they're choking. Of course they want help. But did they ask you this? Can I touch you? Have you ever seen that scenario? No one. Okay. I was a CPR instructor at one time, a few years ago. That was a big deal. It was a big deal. They wanted us to say, "Can I touch you?" And for the anybody ever done it? You've done it, Heather. Did it work? All right, Jesse. Okay. All right. Anyone? Because it works. I mean, this thrust is pretty effective. All right. Heimlich maneuver for the choking victim. Okay. The big thing now, there's a big piece in this chapter on CPR. You are all CPR certified. It kind of concludes on the automatic external defibrillator. And in my opinion, as time goes on, more and more AEDs are available. And I think you probably did some work with this when you did your CPR practical. In other words, I have found that these AEDs are very friendly. Don't be intimidated by them. They'll just kind of talk you along. Okay, cerebrovascular accident is another term for stroke. Now, strokes don't happen right away. They take some time. And you'll notice a variety of symptoms for a patient having strokes. paralysis on one side. They'll have a problem with speech. They may be dizzy and have a vision problem. And what's the key here for stroke victims? To do what? Get them to the hospital as quickly as possible. Because these ERs are kind of set up to handle this now. They have a protocol and they have it done. So I'm going to type something in here. I've typed in the capital letters, 4-letter word, FAST. Okay, for the exam, you're going to need to look that up. FAST is a term associated with stroke. Nausea and vomiting, you're going to see, this is an interesting piece when people are thinking about radiography as a career. The subject of blood and body fluids come up. In other words, I've had my share of students who come this way because they're not interested in a lot of blood and body fluid in what they would deal in nursing. So they'll come to radiography and, blood and body fluid is a part of this profession. Not a lot, not every day, but it will be there in terms of you might have a bleed here or two from an IV injection. Somebody could have a finger amputated. You're going to see some blood. The body fluid piece comes with peds, okay? Anybody want to add in where else they might think body fluid could come from? Lumbar puncture, ER, yeah, the enema thing, yeah. Yeah, and people have a hard time with enemas and how to hold them. Give the folks who are having a problem with nausea and vomiting, just have them breathe through their mouth. Sometimes you want to have them lie on their side in case they vomit. It doesn't go backwards, it comes forward if they're lying on their side. All right, epitaxis is another word for group here. Anybody? Nosebleed. Sometimes people get a nosebleed, and maybe you might know of someone where they get a nosebleed, and guess what? Some folks, it just doesn't stop. And they have to go to the hospital for treatment. It started? Okay. All right, so he had and one time only? Okay, here on the campus, we had an example where somebody had a severe nosebleed, had to go to the hospital and have it cauterized, but it was a one-time scenario. Now, seizures here, near the end of chapter 20. There are various types of seizures. Be aware of that. There was a time when people would have a seizure, and part of the scenario of a seizure, they would be biting their tongue and things like that. And there was a time where they encouraged healthcare professionals to kind of try to get away from that. No, no, no. Don't put your fingers in anybody's mouth to try to get that to stop. We don't encourage that. You just want to protect the patient and make sure they don't hurt themselves or someone else. Again, you just need to be visual. And of course, you need to call for help. Now, here's an interesting scenario that I always share with students at this stage. Before I moved here, I worked in a hospital in Illinois where we had a hospital-based training program, and we had a tech. He had petit mal seizures, light seizures. He didn't drive. His wife would bring him to work, or this scenario, you could ride the train to this hospital. It was a really nice scenario. But here was the thing that always, everybody was sensitive to his needs, the fact that, it might happen. And guess what position he had in the department? I'll type it in here. Pardon me? He's saying neuro? Close. He was the OR tech. And I often thought, now, how is he going to do this? What if this happens in the OR? Well, while I was there, it never really happened. And I've experienced he would have drooling and he would freeze. And, everybody knew, we just watched him and it would go away and he'd go about his business. He'd wipe himself up. He worked in the OR. While I was there was no issue. And then I moved to down here and I stayed in touch with a few people. And down the road, apparently there was a situation because he got moved away from the OR. But that was a kind of unique situation that he was the OR tech. All right, falls assessment. Maybe you've been in the hospital a short time. You might have seen, how do they identify falls patients? With what? It's a colored wristband as a rule. Is it orange? Is it yellow? Okay. People will be evaluated upon admission, and if they're deemed a risk, they have the colored band on, they're deemed a falls risk. I don't know what the department will even get them up for a chest image, or you'll have to assist them, okay? But I think they've come a long way with people getting up and falling, okay? Which brings me to another scenario for falling. I'm going to type a word in here. It's orthostatic hypotension. All right, Shannon, you going to tell me what this is? Oh, some folks are typing in here. Let's see if we can get to the bottom of this. The subject is no. Has nothing to do with that. Ortho in terms of correct is the scenario, correct? Most of us have experienced this. These are some good examples that were typed in the box. Pardon me? No, it's like you get out of bed too fast. Here, loosely, if you're scrubbing the floor and you get up too fast, if you're gardening, pulling weeds, and you get up too fast, what happens? You go, whoa, right? What's going on? It is your blood pressure adjusting to the change in your position. So when you sit somebody up on a radiographic table, they don't need to hop right off. Let them sit there a second. But she walked in? She walked in but needed care. Okay. Orthostatic hypotension. All righty. All right, so burns and dehiscence here there's really not much that we have to deal with here, but you need to know what dehiscence is. It's when sutures separate. Just be vigilant. And we get some fluid. We don't have a burn unit here in the area. But the burn unit, if someone is burned severely in this area, they go to Gainesville. And I'm sure radiographers over there, whatever hospital is, I'm not sure, have the protocols down for how to handle burn patients. All righty. I'm going to move on now to a chapter and just say a few words about it. It's titled, the chapter is titled Safe Patient Movement and Handling Techniques. Some people call this body mechanics. You know, it's proper lifting. And the center of gravity is a big part of it. If you'll look there in my book, I'm on page 152. Know where the center of gravity is. It's in the pelvis. I know you guys have been in the hospital for a short amount of time. I'm not sure if you've gotten involved in any body mechanic issues or transferring patients from wheelchair to, you have? Okay. Oh, yeah. See, Memorial has a high incidence of rehab patients that, yeah. Yeah. Yep, people watch your techs. They all have techniques. Okay, just what's the most common injury? Back injuries for yourself. Pardon me? That's totally non-school related, Ethan. All right. Back injuries, do not be a hero. Okay, do not be a hero. Get help. You know, they want you to squat, not bend over. Use your long bones. Principles of lifting. My goodness, and I would venture to think in some of the jobs that you work in, they might give you some of this on an orientation on how to properly lift. You work with anything that's that involves lifting. You know, I've had students come through here who have worked in a warehouse, maybe for Amazon, which isn't far away. Do you? Did they give you some in service on lifting at Amazon? Here we have an Amazon. They don't. There's nothing. Okay. All right. So here's where we always get into. Here's where we always get into this discussion. and I'll type it in. As far as body mechanics goes, and here it is for you guys. If you have a choice, do you push or do you pull? Open for discussion. Yeah, if you push, like for the portable, I don't expect you to pull it. And you won't be able to push it because it's so heavy. You need the battery thing. But if, are you pulling somebody across the table from a stretcher, leaning over? You pull, you push, and I'm sure you've seen both. Yep, yeah. But the thing is, do you have a preference for what's the proper technique? Do you push or do you pull? Pull. But when you push somebody, you can put your whole weight into it. You like pulling? Okay, we're gonna go with pulling. All right, and over time, we've got some sophisticated, look at the device there, the hydraulic lift in figure 13.8, for those of you that have a book. Has that appeared in anybody's department? They have one?
Halos. You see a lot of halos downtown pediatrics.
So we're talking here on campus about patients with skull or neck injury have the halo.
So they're trying to basically them can stand up if the system and get out of the wheelchair. A lot of them really need a lot of help with signs of the organs are and everything.
Oh, yeah.
These images they hook them on quick and tighten it. So their spine is.
They want it as straight, as accurate as possible. All right. Discussion here on campus from Baptist downtown for scoliosis patients. The halo will be attached to a device that won't have light pressure to try to straighten out the spine for the radiographs. Good story. You guys have seen a lot, okay? You guys have seen a lot. All righty, so that's what I wanted to say about body mechanics, watching the hospital, how they do it. There are devices, and the last thing is you don't need to be a hero. All righty, so that's the discussion on patient care for today. So we're going to transition over to physics. Of course, your physics test will open today. Be open to midnight Saturday. You'll get an email with bonus. You have nothing to lose by attempting at the bonus. You'll have to email me your work on the bonus. Show me your work. I give partial credit. And there'll be 3 problems, and the level of difficulty will increase as the problem goes on. You don't have to do them all. You can do 1, 2, or 3. But that's where we are, and then that will be your second exam for physics. So let's continue with our chapter. And we are in the chapter on electromagnetism. The category is electromagnetism. I am on page 64. There'll be some simple problems on the test. Ashley's asking if there are some problems on the regular test. Simple problems, use the VIR triangle. All righty, electromagnetism. For the definition, they talk about something called a phenomena. What's a phenomena? Type it in. Okay, I like that, Shannon. Out of the ordinary occurrence. What did you have, Ethan? Uncommon occurrence. The term I like for phenomena is something that occurs that can't be explained. It's a phenomena. All right, here's why we talk about phenomena, because this is where they associate it to electromagnetism. And this is a key fundamental point that you need right now, that when you have a conductor, and we refer to that as a wire, with current flowing through it, two things, wire with current flowing through it, there's a magnetic field around the wire. And we talked about magnetic fields at the last class, like we've all played with magnets and we feel it. When we play, we feel the attraction, we feel the repulsion. So when you have a wire with current flowing through it, you have a magnetic field. Let me just bring another piece in here. If this wire is alternating current, in other words, it alternates, the field goes up and the field goes down with alternating current. More on this later, but I want you to try to visualize that now. The field goes up around the wire and then it goes down. There's a point in time where there's no magnetic field because there's no current flow. Keep in mind, you only have the magnetic field when the current is flowing. Now, I'm going to give you three terms here that are related to this. And these terms are in your book, so let's take them one at a time. There's the first word. What is a helix for those of you on campus? Helix. A helix is simply a coiled wire. The next term is a solenoid. A solenoid is a coiled wire with current flowing through it. So this is a helix. If we put current through it, it's a what? Solenoid. And now, if we put, I'll use another color. An iron core through the coil. We have something called an electromagnet. When you put this iron core through here and you put current through the solenoid, it intensifies the magnetic field. All right, so let's stop here a minute and talk about, here, I'll let you guys, can you see this? I'll turn it some more. Okay. Where in radiography do we have electromagnets? Ethan says detent. Very good. Where else? You guys have all done it. You've all done it in the room here on the lab. Anybody? All right, so let's review where you've all done it in the lab. In the lab, you know, we have an X-ray table, and it has a floating tabletop. You know, you can move it around. So that lab right now, the power is not on. There's no current. Can you float the tabletop? It's not going to float. Till you turn the room on. And then, of course, to float the tabletop, don't you have to engage something? Right? with your foot, and then you can move the tabletop around. So what you're doing is with your foot, you're opening and closing a circuit controlled by an electromagnet. And I'll share with you another story where an electromagnet came into play. When I was teaching at UF Shands, you know, right next to it is the medical examiner's office. And everybody, I think, knows what they do there. And they have an X-ray room over there. They do radiographs on what? Dead bodies. And they called us over. They called us over to do a radiograph on a deceased person. And the person was shotgunned, and the physician wanted to see, you know, an upper torso image. He tried to get an idea of the angle with which the gun was coming from in the buckshot and everything. So we took 2 students, and my assistant, there were 4 of us went over. And like a good program director, as soon as we walked in the door, I said, well, I'll do the dark room. So I did the processing piece of it with film. So my assistant, the patient was on a stretcher, of course, and he says, you X-ray through a body bag? You know, so we really opened the bag, positioned the cassette. There was a very strong odor. And I think for that reason, we all had scrubs on. People were concerned about the odor getting on their uniform. And he's ready to make an exposure. This was a radiographic room. They were doing it on a stretcher right next to a table, and he couldn't get his exposure. He says, well, I can't get an exposure. I can't figure this out. And I said to him, all right, let's try this. Let's close the door, okay, to the room. And it was wired this way, for the door to be closed to get an exposure, and it worked, okay? Are they that way? Not all rooms are wired that way, that the door has to be closed. Because I'll tell you, you don't need that wiring to close the door. Go ahead, make an exposure with the door open sometime. And if somebody's walking by, you'll hear about it. Okay? But in this scenario, we needed the door closed to complete the circuit. Okay, the electromagnet to kick in and let the exposure continue. So there was a little story there. So these electromagnets, and going down the road, you may see scenarios where an electromagnet has come into play. All right, so we've got those terms down: helix, solenoid, and electromagnet. All right, so Graylin says they have that scenario at Baptist South. In other words, the door has to be closed. All right, now we're going to move on and talk about something called electromagnetic induction. Electromagnetic induction. Oh, Shannon wants to know, the electromagnet has an iron core through the solenoid. Okay, electromagnetic induction. Here's your key on this introduction. Whenever a wire cuts across a magnetic field a voltage is induced into the wire. All right, so I'm going to give a pictorial of this, and I'm going to use my fingers as a magnet. Everybody, you know, north and south pole, magnetic lines of flux in between my fingers. Everybody cool with that? You got that picture? Now I take a wire. I'm going to call my marker the wire. And if it goes like this, the wire is cutting the lines of flux. What happens in the wire? There's voltage produced in the wire when it's cutting. All right, so here's one scenario where we move the wire, right? We're cutting the lines of flux, or we can do this. Hold the wire still and move the what? The magnet. Are we still cutting lines of flux? Yes, we are. So there's two ways to do that. The faster we do it, the more voltage produced. So write that down. The speed with which the flux is cut, greater voltage. In the wire. There's another factor. I'll let the students here get their notes caught up. All right, so back to the magnetic field between my fingers. The wire, now the angle with which it cuts the flux, the greater the angle is to 90 degrees to the flux, the stronger the voltage. Instead of going like sideways, no, we want to cut the lines of flux with the wire 90 degrees. All right, some folks have asked me to repeat that. Here's our magnet, north and south poles. We have between the two fingers here, magnetic lines of flux. If I cut them at 90 degrees, I get maximum voltage compared if I angled the wire. Okay. Now, one last thing on this. We talked about the speed of the wire. We talked about the angle of the wire. Now let's look at this. We still have our magnetic field. And I was using a straight wire, right? Everybody agree? What if this was coiled? What if this was coiled? You can coil a wire and move it through. The voltage induced will be greater. Just think about it. The coil, you have more wire doing this compared to just this. I can't coil a marker. The voltage will be greater if the wire is coiled. Now, there's something that you've all seen, what I've just described. I'm going to bring the drawing back in. You have seen this before. I'm going to draw out here now. I'm going to draw something that works on this principle. And you have all seen this at one point in your life. Okay? Now, shout it out when you recognize what I'm drawing, if you can. Same for you at home. Okay? Okay? Online, when you recognize what I'm drawing, type it in. All right? Am I drawing anybody? Come on. Huh? Yes. Let me see if anybody typed it in. All right. You won't offend me about your comments on my drawing. I put up with it for years. Okay? And if you have to draw something for me on an exam, I don't critique, I don't judge that either. But come on, is somebody said it's a TP. It's not a TP. Okay? It doesn't look as good here. It is a windmill. Can you see it? See? Here's the base. Here's our little box. All right. There's our fan. But the wind moves, right? Something is what? Turning. And what's in here? What's in the little box at the base of the windmill? A magnet. Okay. And what's turning in the magnet? A wire. The wire is turning in the magnet right here in the little box, generating what in the wire? Voltage, so what the farmer can do what? Have electricity. No, Shannon, we're not to motor yet. We're just talking about electromagnetic induction. That's how a windmill works. We're moving a wire in a magnet. The wire moves because the wind blows. So a windmill is an example of electromagnetic induction. All right, now I want to talk about two other ways to create induction. One is called mutual induction. And I like to give a little example before I give the formal one here. All right, so mutual induction. Now, there's no doubt that between the group here today, somebody probably went to the beach and got a good suntan. Or not tan, but burned. You know what I mean? And somebody gets a little too close to them, like arm to arm, and what do they say? I can feel the heat, right? I can feel the heat. I use that to introduce the concept of induction or mutual induction. Mutual induction just kind of means side by side. Side by side. Now, if you look in your book, I'm going ahead. I'm going ahead. I'm on page 80, and I'm looking at the X-ray circuit. You see it there labeled in purple, or colored in purple. All right, you'll see something in the X-ray circuit titled High Voltage Step Up Transformer. You guys with books, do you see it? All right, so do you see coils of wire with an iron core through it? There's two of them, right? One has more coils than the other, correct? They're side by side, right? We put electricity through the left side. The right side gets induced with voltage. Mutual induction. It's side by side. We're not going to go in to the nitty gritty. We're going to get more of that. This is the X-ray circuit, and you will know this by the time we finish this course. But I just want you to understand mutual induction. Wires side by side, inducing from one to the other. Mutual induction. All right, and the last thing on, in comparison to, stay on this page, we're going to talk about something called self-induction. Something called self-induction. Now, like your book says, that this is kind of difficult to understand, and we're going to make this simple. In other words, with self-induction, if you look on this illustration of the X-ray circuit, you see something labeled auto transformer. See that? And of course, then you see the wire in the iron core. Everybody see that. And then you see, it kind of looks like a big teardrop. You see it? That gets turned, that gets moved, and what you do here is you tap off a percent of the voltage going through the wire. Okay? We'll make it simple. If there's 100 volts going through the wire and you tap off 8 of them, you have how many volts? How many? Okay, if there's 100 volts going through the wire and you tap off 8 of them, 8 of those little stops there, what percentage is 8 of 10? 80. Okay? No? Anybody confused? We're making this simple. You have 8 stations on the wire, and you see the little teardrop that you can move. Better? Cassidy, better? Okay? You get 80 volts. If you tapped them all off, you'd get how many? 100 volts. We'll come back to this when we study the circuit in depth, but now you're familiar with a couple things in the circuit, and I'm going to give you one other hint. Have any of you in clinical, I know you've been there a short time, have any of you set up a technique on the control panel? No one's done that yet?
Yeah.
Who has? You have? Did you set up KV? On a portable? You set up KV? On a portable? All right, so how about you guys at home? Anybody set up KV on a portable? Now, this happens in the department too. But KV on a portable? All right. You know what that KV selector is? Look at the drawing. That's an auto transformer. Okay, so when you're setting KV, you're adjusting that auto transformer. That's called, you need to know this. The auto transformer operates on self-induction. The step-up transformer operates on what? Mutual induction. So every time you adjust KV, you are adjusting an auto transformer. The auto transformer is what you adjust when you change KV. So associate KV, auto transformer, self-induction. The step-up transformer, you see 2 coils side by side. They operate on mutual induction. All right, that's mutual induction and self-induction. And we will stop here for today. We'll pick it up next time with generators, and we will finish this chapter. Pardon me? Too much? Pardon me? There it is. There it is. But you know what? We'll be doing it again. Yeah, we'll be doing it again. But you got the idea today about current, alternating current, magnetic lines of flux, cutting the lines of flux, self and mutual induction.
So just to clarify,
I have a question here.
so the electromagnetic and different types of, so is mutual induction and self-induction both parts of electromagnetic?
Yes, they are. Yep, two ways. So look at it this way, Heather. It's two ways to induce current. All right? Kristen, this will be, yeah, I did record this. This will be under your physics shell in the canvas. All righty. All right, it's time to move on. And this material we covered today will not be on the exam. This is down the road. Now it's time to do some housekeeping. Let me just talk about your timesheets. You should have 2 complete now. At the bottom of the first week, you should have written in pen or pencil, 16. And for this week, at the bottom of that page, you should have how many? No? 16 and 16 is what? 32, yes. Okay, so it's an ongoing total. Next week, page 3. Okay? I always like to remind students at this time of year and in the spring, what are you going to do Saturday night? Yeah. Ethan says he's going to be drinking, and here's the bonus. You get to turn your clocks back. All right? Don't forget, you know, if you haven't learned from me yet, I'm big on tradition. This is something I traditionally do. Remind the students to turn the clocks back. All right. Yeah. Well, you really can't go many places, can you? Hey, there's a question here on campus. Is Halloween canceled? Look, put a little table or chair out front, put some candy on it, with a little note, and be done. Can't you do that? Oh, yeah, you got to go through it. Get all the good stuff. All right, one last thing now. And this is clinically related. You know, it's been about 4 weeks now since we've gone back to clinical. Since we were notified that we could return to clinical, it's about 4 weeks now. And, you know, it was kind of a mad scramble to get everybody ready. And the way we're doing clinical these days isn't quite like what we would be doing under normal circumstances. Okay. And, you know, and we've all had to adjust, you know, our lives because of the pandemic. Whatever facet of your life you want to look at, work, personal, church, family, and school. And you guys have really done a good job of being resilient with the changes that come with modifying the program so that you can get to clinical. And here's the uptick too. You guys are on schedule. You guys are on schedule. It may not be ideal, you know, but there's always something that will come your way where you've got to adjust. Okay? So I've got another scenario now where we have to do some adjustments. All right? And going forward in this conversation, it involves only one group of students. Students doing clinical at Baptist Downtown. If you're not doing clinical at Baptist Downtown, this doesn't involve you, but you can listen. Okay? So here's the adjustment that we have to make. Because I talked to Dina earlier in the week, they've been wonderful as far as I believe of accommodating the college. But she says, you know, we just have too many students because of the adjustment they've had to make with how clinic works. She says, and I have to do this with the senior class too. We have to make an adjustment in terms of how we can operate clinical. So the decision was made, and I've worked on something, and it's nothing that severe, but for every time clinic is in session, two students in the group will have a day off. All right? Now, we got somebody doing backflips up here on the North Campus. But here's the thing. It's only going to be, for most of you, a day. It's just going to be a day. So I'm working on a schedule that will come out that will note your what? Your what? Your day off. All right, that's it. So, yes.
Could you actually make this announcement? To let everybody know that when you get assigned to Peds, she said if you could send out a message to the students letting them know they need to split the Peds rotation, the other student can see on where to report.
Okay.
That's what she told me.
I'll let you guys handle that. Okay, she reached out to you, or? No, this has nothing to do with that. This is the fact that when you go to clinical Monday, two of you won't be there. It'll be at two different students on Wednesday, and so forth. So I'm working on a schedule. Two every day. It's just one day. Every day. Two others.
Monday after, so there's no more days missed after that.
Well, you know, it's not perfect. Okay, some students will have 2 days, but not everybody. So here's how this works. Here's how this works. So if you're Baptist downtown, listen up. If you're at Baptist downtown, this Monday, okay, Tara and Terry Ashby, you're off. It's this Monday. Wednesday, Jasmine, and I don't see Kieran's name here. What's so funny? Wednesday, Jasmine and Kieran, you'll be off. And then going forward, you'll get a schedule from me. So, it's not the end of the world. It's just, again, an adjustment they've asked us to make. So, no, you don't have to make this time up. And in fact, listen up. I want you to fill it in your calendar has 8 hours. I want it to be in your calendar, write 8 hours on the calendar, scheduled day off, and add it at the bottom of the page. Because I don't want to get a bunch of calendars back in December with numbers all over. Okay?
Could you pronounce more of those, on login?
Comp sheets? Yeah, we can get you some. Roster?
Yeah, the sign, you have the text on.
Oh,
It might be already printed here.
you mean the calendar?
No. Yeah, the thing that has the 7 days of the week. and
Yeah.
boxes, and we only fill out 2 of the boxes.
Yeah, I mean, you got a blank one, just print it out. There's blanks out there. I sent Mia, you have a blank, I believe. Yeah,
Do you mind if we flip it and do like half penis and pull it up a bit nice? Easier and stuff?
just so I can read it. So I can read it at the end.
Fine if it's
I don't care, just so I can read it.
paper.
See, people do this as far as there's some discussion here on campus about the calendars. It's incredible over the years what I've gotten back on these calendars. Their hours are there, but so are their personal notes. So-and-so dentist, birthday party here. Yeah, that becomes their life. So yeah, I get that back once in a while too. All right, so here's another piece too, as far as you guys who are from downtown. Look, don't reach out to me and say, can I have this day off? I'm not doing that. Okay? The schedule will be put out, and if you want to trade, listen, if you want to trade with somebody, you can, but you know. Okay? You guys understand here on campus how this works? You'll get a schedule. Shannon, most people are gonna just be off one day. Did you get the gist of this, Madison?
Yeah, I was coming over here because that's typically.
I know.
I was asked you on this.
Or a classmate?
Someone else sent me an email.
Yes, she did. I did. Any questions? Again, this only involves students who are downtown. All right, that's what we have for today, you guys. Enjoy your weekend. I do. Ashley wants to know I do have the quiz. Ashley, I should be here till about 2 o'clock.
Yeah. That's what I was,
Jesse, I got another project for you. Somehow Kieran's got to know not to go to clinic. Oh, he's not off till Wednesday. Thank you.
Yeah, is she not?
No. Absolutely. Kristen wants to know, let's see, if you do the paper and sign up, do you get extra? It's one or the other, just one. I'm making a schedule, it'll come out. That is correct, Jasmine, that's your day off. Absolutely. Yeah, the lecture will be posted today under physics. Kristen, I reviewed for that exam.
It's not on the hand, it's on the hand for you, because
She did something with our.
why are we putting this in?
I don't know.
I think the same, but I was wondering why it kept updating like that.
Yeah, when